Welcome everybody. So this is Dr. Simnaini. Today Simnaini is going to talk about reversing diabetes. This session will go for around 45 minutes. So in this, she'll be talking about the concepts of reversing diabetes, and afterwards, I will do a brief introduction about what work we are doing from Divine Veda, and then we'll take up the Q&A. Hope it's fine with you with all of you. Yeah. So, doctor, you can start.
Good morning to everyone. Today we are going to discuss about the reversing diabetes program. So basically, I'm providing the gist on the book by Neil Barnett on diabetic reversal program. First, what are the contents of today's presentation? We are going to see go through like what are types of diabetes, what actually is diabetes, what are the investigations basically given. Then we are going to see how optimal lifestyle is going to modify the blood parameters and help us in decreasing the blood sugar level. When we are planning to start a new menu for our patients or design a new menu, how what are the main principles to be understood in that. Then we have a power plate. What should the plate mainly contain? How much amount has to be contained? And what is the role of supplements and exercise in controlling the diabetes or reversing the diabetes? What actually is diabetes? Diabetes mellitus is a metabolic disorder. Basically, the metabolism includes metabolism of the food we take. Let it be carbohydrates, proteins, fats, whatever food we are taking should be metabolized by our body and use it for energy. So when the metabolism gets affected, it leads to a disease called as diabetes mellitus. It involves inappropriately elevated blood glucose levels. Now, when will we diagnose it to be diabetes? When blood sugar level is 126 mg per dl or higher after 8 hours of fast. Blood glucose level is 200 mg per dl or higher after 2 hours of glucose tolerance test. HbA1c is 6.5% or higher. What blood sugar levels we already know. Like before food, in fasting blood sugar level 126 and postprandial blood sugar 200 mg. Now HbA1c 6.5%, which we take as an
Doctor,
average of every 3 months. Generally, I'm going to mainly explain what is oral glucose tolerance test. In this test, the plasma glucose level is measured before and 2 hours after the ingestion of 75 grams of glucose. So, what happens is in previous night, we consume a diet with at least 150 grams of carbohydrates. So, like that, for 3 to 5 days, we continuously consume. We do not take any medicines so that level is not altered, and we do not take any steroids or thiazide diuretics. After 3 to 5 days, just before 2 hours, we ingest 75 grams of glucose, and it is confirmatory of diabetes if the plasma glucose level in 2 hour sample is more than 200 mg per dl. So this is like the most confirmatory test done. So this is how oral glucose tolerance test is done. If it is more than 200 mg per dl, it is a definite diagnosis of diabetes. Now, what are the types of diabetes? Types of diabetes includes type 1 diabetes, type 2 diabetes, gestational diabetes. Now, type 1 diabetes is basically our body has an organ called as pancreas. It is supposed to release insulin. Our body cells are supposed to use it and use the insulin, and glucose is to be metabolized. Now, this is a diabetes which happens generally in childhood or young adulthood. It is insulin dependent diabetes because the insulin supply is completely altered. There is autoimmune destruction. There is alpha, beta, and gamma cells of pancreas. The beta cells of pancreas, which is responsible for insulin production, are completely destroyed. Now, how are they destroyed? Because our body thinks that these cells are foreign cells, and our body itself attacks the beta cells, and it leads to destruction of these cells. So, because there is autoimmune destruction, this is an autoimmune disease. There is autoimmune destruction happening. The cells are completely being destroyed because the cells, beta cells, are not there. There is no insulin in the body. So, the treatment is we have to externally give insulin to the patient. Now, there is latent autoimmune diabetes of adults, that is, generally it happens in young adulthood or childhood, but if insulin dependent diabetes or type 1 diabetes gets manifested in the adult stage at the older age, then it is understood as latent autoimmune diabetes of adults. Now, what is type 2 diabetes? Type 2 diabetes, here insulin is there, insulin production is happening, but our cells are not able to absorb the insulin. Now, for this, in this book, Neil Barnard, they have given a very beautiful example, like how a lock and key mechanism is there. When there is a lock, you have to fit in the key so that you open the lock. Similarly, insulin is there. Insulin is like the key, and it has to fit in the cell so that the glucose is utilized. Now, what happens? They have given like the jamming system, like how a key gets jammed. Similarly, when we take phospholipids or any kind of lipid substances, that is, any kind of fat substances, there is obstruction. The key doesn't get, the insulin cannot fit into the cell, so the insulin is not able to utilize the glucose. Instead of insulin, fat is going and getting deposited, so in between insulin and the cell there is an obstruction by a fat layer. Now, uh, why does it happen? Because we are taking a lot of fat food on a daily basis. This is happening. So basically this is called as insulin resistance. Insulin tries to bring glucose into cells, but there is insulin resistance from the cells happening. If insulin cannot overcome the resistance from cells, glucose starts building up in the bloodstream. Now, what happens if glucose gets built up in the bloodstream is, when there is excessive glucose, it starts damaging the organs. It damages the eyes, it damages the kidneys, it damages the nervous system, which will lead to different manifestations or complications. Now, there is gestational diabetes and maturity onset diabetes of the young, which is called as MODY. What is gestational diabetes? This happens only during pregnancy. Mainly, again, it is a type of type 2 diabetes only, so mainly insulin resistance is happening. Why does it happen? There is a hormone which is released during pregnancy called as human placental lactogen hormone. When there is alteration in this hormone, what this hormone does it, genetically it does alterations in the insulin receptor. The insulin receptor gets affected, so again the cell cannot take the blood sugar level cannot be utilized. That leads to diabetes. Here, sometimes what happens, as soon as the pregnancy is over, because the hormone secretion gets stopped completely, there is complete disappearance of type 2 diabetes. But if the proper lifestyle, everything is not followed, again in future the pregnant lady can get type 2 diabetes. Instead of gestational diabetes, it gets converted into type 2 diabetes. Now, next type, fourth one is maturity onset diabetes of young. That is, again, this is a genetic disorder where basically beta cell dysfunction is happening. Auto antibody test is negative in this. Insulin is produced, and what is the difference between type 1 and maturity onset diabetes is, in type 1 there is complete destruction and insulin is not produced, whereas in maturity onset diabetes only partial of beta cells get dysfunctional because of a sufficient insulin is not produced. Because there is insulin insufficiency, few cells are utilized. Few cells utilize the glucose, few cells cannot utilize the glucose, further leading to diabetic symptoms. Now, what is the treatment modality? Basically, all the diabetic drugs which we are giving are focusing on three types of mechanism. First mechanism is either on increasing the insulin sensitivity of the cells. From our treatment modality, basically diabetic drugs are focused either on increasing the insulin sensitivity of the cells, or B, cause pancreas to send more insulin to the bloodstream so that the glucose gets utilized. 3, block the liver from sending extra glucose into the blood. So these are the main three focuses. Now, next slide is what are the optimal lifestyle? What are the main pillars for maintaining the optimal lifestyle? There are four main pillars, That is, healthy diet has to be followed. There should be no smoking, regular exercise, and stress management. Now, for healthy diet, first we'll focus on healthy diet. Uh, that is, before understanding healthy diet, we'll see what are the causes happening in type 1 diabetes. So, there was a study done in Finland, almost 242 newborns with the degree relative, that is, nearest relative, the first degree of relatives having diabetes was taken. First breastfeed in group A, there was first breastfeeding. First breastfeeding was done, then weaning was done, and in group A, modified baby formula was there, where dairy products were further broken down into individual amino acids. Group B also, the babies were breastfed, and then weaning was done, and then cow's milk formula was given. Now, after doing this, a study was done. After 6 months of study, what result they have got is in Group A, where the baby formula was broken down into amino acids and given. The only three babies developed DM in the later adult stage, whereas in Group B, almost eight babies developed diabetes mellitus. Now, even in the Journal of Medicine of New England, they saw that antibodies in response to cow's milk proteins. That is, when cow's milk is taken by the body, what our body thinks this is a new agent, or this is something like a foreign agent, and it starts destroying. That it starts developing antibodies in the body. So portion of one more thing what they have found out is portion of cow's milk protein. That is, if you check genetically how a cow's milk protein looks in the body, similar appearance and similar structure, chemical structure, was found in insulin producing cells. So now when antibodies are being developed in the body against cow's milk, antibodies were automatically developing against the insulin producing cells. So when antibodies are developing, they are leading to destruction of the cells, insulin producing cells. So autoimmune destruction is being triggered by body itself. So one of the causative factor is that dairy products like milk is the responsible for developing such antibodies. And so, what they have found through the study is we should encourage breastfeeding and early age onset, like within 6 months of the baby's life. We should not start with other milk products like cow's milk or buffalo's milk or goat's milk. Such things should not be started, and better immunity and IQ. This study also proves that it is not necessary that dairy items or dairy products have to be taken by the body, and it is also not necessary that dairy products can be utilized by the body very well, because they can all bodies are not tolerable to that also. So one more thing I would like to add through this slide is, even when prameha nidanas are told in Ayurveda, they have specifically mentioned like anuparasa, mansarasa, kshira, and payamsi, dadi, all such things have been mentioned. So even our acharyas back then have focused mainly on dairy products, which meat products, like exercise has to be done, like asya sukham, swapna sukham. People who do not do exercise, people who sleep constantly be and then dadi, gramyoduka, anuparasa, all marshy animals meat, payamsi milk, all such things have been mentioned back then. So those all can be also understood through this uh, study or research. Now, what is this book mainly focusing on? It is helping us design a powerful new menu. It mainly has three main contents what we have to keep in mind by designing the menu. That is, we have to first set aside all the animal products. Now, animal products doesn't mean only the meat products, it means eggs also, it means milk and milk products also. Any dairy products coming from animals, and all the meats, let it be chicken, mutton, beef, or anything, has to be kept aside. Eggs also have to be kept aside. Then second point is keep vegetable oils to minimum. Whatever the source of vegetable oil it might be, the fat, it depends on the how much quantity of oil we are using. So vegetable oils, no matter what source it is, have to be kept in minimum quantity. Next, third point is we should favor the foods with low glycemic index. Now, what are high glycemic index foods and low glycemic index foods will be discussed in next slides. Now, set aside animal products. Avoid beef, chicken, fish, eggs, all of them. Now, why should we avoid these? What they basically contain is more amount of fat. What kind of fat? Saturated fat. Now, there is something called as saturated fat, unsaturated fat, and trans fat. Now, all these animal fats are called as saturated fats, which are helping in increasing the bad cholesterol of the body. That is, there is high density lipoprotein, low density lipoprotein, very low density lipoprotein. Low density lipoprotein and very low density lipoprotein are the, we all must have heard, these are the most dangerous types of lipoproteins or cholesterol, which are going to build up in the body and cause different kinds of heart issues or liver issues, or as such I told about the lock and key mechanism, fat going and getting deposited and obstructing the glucose uptake. So these all are going to increase the saturated fat. Now saturated fat in order again increases the, pushes the cholesterol upwards, and it again reduces the insulin resistance, leads to the insulin resistance. Now, few people might ask us the doubt, what is it? If this fish is known to have omega fats. Fish is known to be a very good source. Why we should not have fish? So for this, we have an answer that none of the there are none of the papers which are supporting with the scientific evidence that fish oil when taken or omega 3 when taken, it is for sure going to reduce the likelihood of heart attacks. There were no studies have proven such, so we cannot just claim that fish oil or the omega oil which is taken from fish is very healthy and it is going to reduce cholesterol or decrease the likelihood of any kind of heart attacks. Now, what is low glycemic index foods? Low glycemic index foods means eating a diet rich in low glycemic, like low sugar levels. Now, what happens in our body? Already there is glucose built up in the blood. Whenever we are putting more high glycemic foods like cakes, pastries, cool drinks, soft drinks, any such kind of things are taken which are high in sugar level content, it is further going and getting accumulated in the blood. Already there is insulin resistance, cells are not able to take the glucose. Further, this goes and adds up glucose. It is just going and including the increasing the load of the body. Now, eating a diet rich in low glycemic foods such as pumpernickel, flaxseed, bread, beans, peas, lentils, nuts, everything help in greater improvements in glycemic control. Now, there was a study done in diabetic patients compared with a diet rich in cereal fibers, and a new study has shown that after 6 months of eating food with a low glycemic index, patients lower the glycosylated hemoglobin, that is HbA1c levels. The study proved that if you compare a person with taking who is taking high glycemic foods and having diabetes, and low glycemic foods and having diabetes, the low glycemic foods supported in decreasing the HbA1c in much better way. Now, what all should our plate contain? Okay, now a patient comes to us. Okay, doctor, can you please tell us what all should my plate contain? What all should I be eating? Now, for this, the answer is these are the things which have to be in the plate. That is, there should be a whole grain group, there should be a legume group, there should be a vegetable, there should be fruits, and we have to remember what should we avoid is meat, fish, poultry, eggs, added oils, any kind of fried foods, milk and milk products, avocados, olives. Now olive also in this book they have specifically again mentioned that there was a news where they were telling, or for a very long time it was olive oil was being advertised as a less fat oil, but that is not true. But it depends on the quantity of the oil you consume. Both are having the more amount of this fat content in there, oils only. And one more thing is there is a concept of satmya also in Ayurveda, which tells based on the place you belong to, the oil you consume is suitable. So we should not blindly give like olive oil is healthy to everyone. It depends on the place, habitat, the food they eat. Like suppose ragi is very suitable in the place of Karnataka, in place of Hassan where I'm staying. Sarson ka tel, that oil is more consumable in North Indian states, and coconut oil in Kerala. It's found there. It is used, and people are satnya to it. So such things have to be kept. One more thing is we have to make sure that the minimum amount of oils are used for cooking. They have given other alternatives like steaming the vegetables, steaming and frying, stirring the vegetables and using instead of uh, old and traditional sauteing method. Instead of that, steamed cooking, boiling the vegetables can be utilized. Peanut butter, high glycemic index like white bread, white potatoes, see white sugar, white bread, white potatoes, white rice, all these whites are supposed to be avoided because they're high in glycemic index. Now white rice, what happens is the coat, everything has been removed, so only that doesn't have much of the fiber brand because it is removed. The vitamins, everything are removed, and that white part is only giving us increasing the sugar, nothing else. Then, are any supplements required? If is the question. Yes, vitamin B12 is a very important vitamin, and vitamin D. Both are necessary to be added in a daily basis. Now, vitamin B12 and vitamin D can be added through any regular medical store. This can be given as contents. Now patients will come up with, okay, we want to take something like this and have the benefits, so what should we have? An alternative foods. So for dairy milk we can give alternatives like rice milk, almond milk, coconut milk and badam milk. It will be as satisfying as milk. It will be uh, having similar qualities, and it will not even increase the blood sugar levels. Now egg, for egg there is egg replacement powders available in the market, and there's something called as tofu had been recently very famous. People started taking tofu. It can be taken instead of egg. Sugar cravings, people sometimes have sugar cravings. For such cravings people can take either stevia or sucralose or maple syrup. Then chocolates. Chocolates, instead of chocolates, they can take defatted cocoa powder. Instead of ice creams, they can take low fat frozen ice cream made of soya milk. Instead of cheese, nutritional yeast can be taken. Instead of hot dogs, burgers, and deli meats, tofu veg burgers. Instead of like non-veg hamburgers, they can take veg burgers. Such modifications can be done. Now, step one is check out the new possibilities. What are the new possibilities? Is going towards vegan food, completely veg food, low fat food, and low glycemic index. I have so many menus and so many examples I have been given. I have just taken one example to explain. For breakfast, we can advise something like veggie sausage, rye toast, or oatmeal. For lunch, we can give green salad, split pea soup, hummus sandwich. For dinner, we can suggest spinach salad, pasta, steamed broccoli. And the snacks we can give, like whenever they're hungry in between, they can take fruits like apples, oranges, bananas. Now, there's a very interesting thing about fruits. It is there's a mechanism told that basically our body is mainly focusing on the weight of the food, not on the type of the food. So our body needs this many calories. So basic foods to test and try are these: oatmeals, beans, vegetable, lentil soup, chicken pea, brown rice, barley. Such foods have to be tried. Now, in this they have mentioned, do not tell for 3 months, 4 months, 6 months like that initially. Initially, let us try the new menu for 3 weeks. 3 weeks of functioning, like for breakfast, lunch, and dinner can be done. 3 weeks if we strictly follow, and if we are getting adjustable, we can keep changing in between. We should not changing in between doesn't mean we are switching to non-veg or milk and milk products or more fat content. We can just switch in different recipes. Now, healthy weight loss. Healthy weight loss mainly focuses on right kind of food, not on the quantity of food. That this is what I wanted to tell in the previous slide. That it is not the calories is not the matter, but the right kind of food you choose also matters. You have to have a satiety when you have the food, but how will you develop the satiety? You can develop satiety through raw vegetables and fruits also, which are rich in water content, which is going to satisfy the appetite. Or we can have non-veg or fat food also, and give the satiety. Now if we choose this kind of food, vegetables and fruits, which give satiety, it is going to produce health, whereas the others is going to just lead to destruction of health. Now we should favor high fiber food. High fiber food like brown rice, legumes, beans, and vegetables have to be favored. B12 supplements have to be taken every day. Appetite control, satiety is produced mainly from the weight of food. If you start consuming soups and fruits whose weight is from water, it automatically helps in cutting total calorie intake in a day. Glucose testing. Now, what is the test? How many times we have to give a blood test, or when the patients come, when we should check? So, for this, the point is in type 1 diabetes, type 2 diabetes, gestational type 1 diabetes, I'm sorry, it's not type 2, type 1 diabetes, gestational diabetes, it is advisable who are type 1 diabetes, type 2 diabetes with insulin, and type gestational diabetes, it is advised that we have to do the glucose testing daily thrice. In type 2 diabetes, testing is not fixed, but the regular checkup every 2 to 3 months has to be fixed while talking to your physician. Hypoglycemia is often defined by a plasma glucose below 70 mg per dl. Now, when we are giving aggressive diets and when we are asking patients to switch, automatically they start losing their blood sugar level starts coming low. So, when do we identify as hypoglycemia? If it is below 70 mg per dl. However, signs and symptoms occur only when it is dropped below 55 mg per dl. Now, there are few now patients are already taking diabetic medicines. There are few medicines which are going to induce diabetes hypoglycemia immediately. There are few medicines which are not going to induce hypoglycemia. Generally, when we take glucophages like metformin or thiazoloids like pioglitazone and rosiglitazone, there is no hypoglycemia happening. So it can be safe drug. Like when the drug is taken, immediate falling of glucose doesn't happen. But when should we be careful? We should be careful when the patient is taking insulin or glipizide, glimepiride, natiglindine, and repaglindine. When such medicines are being taken, they can immediately cause the insulin. Like there's already insulin dropping, the sugar level dropping happening, and such medicines are taking. It helps in aggravating the hypoglycemia faster. So these have to be kept in mind, and these have to be checked so that the patient doesn't have any possible risks. Now, next is what are the symptoms? How do you notice that there is hypoglycemia happening? So, there are few symptoms like shaking of the hand start, sweating, there is excessive sweating happening. The patient has a lot of hunger, anxiety, weakness, there is rapid heartbeat. Patient complains of dizziness or lightheadedness, sleepiness or confusion, difficulty in speaking. This hypoglycemia is very important because it can be leading to diabetic coma stage. So that is a very severe stage. So these symptoms have to be identified immediately. Then at night, there will be nightmares or crying out. They see that pajamas or bed sheets where they sleep, there is perspiration, they are wet. That means they are going into the stage of hypoglycemia at night. Awakening with unusual tiredness, confusion, irritability at night, all these are the symptoms. Now, what are the treatments we can give? Immediate treatments when the patient is complaining. 15 grams of glucose is advisable. Half cup of any fruit juice immediately. Half cup of regular soft drink can be given. 5 or 6 pieces of hard candy can be given. 1 or 2 tablespoons of sugar can be given immediately. Now, a quick fiber check in diet. So, this book has given a very beautiful table chart kind of thing, where you can count how many fibers, how much fiber is there in your diet, and accordingly increase, decrease, or maintain the fiber in the diet. If you're in a regular basis, if you are consuming beans or lentils half cup in a day, then 7 points can be given. that scoring can be given. Vegetables every day 1 cup, 4 points can be given. If medium piece of fruit is consumed every day, 3 points can be given. Fruit juice is consumed, 1 point can be given. Whole grain bread or pasta is consumed, 2 points. White rice is consumed, 1 point. Brown rice, 3 points. If there is score less than 20, then more fiber, appetite is hard to control, occasional constipation. If the overall score is 20 to 39, food is more satisfying and cuts calorie intake a bit. If the score is 40 or more, it is a very good score. It means there is plenty of fiber to keep the hunger in control. So we should make sure that the score falls 40 or more in the people, so that the fiber is very good in their diet intake. So the hunger is properly, appetite is properly controlled. So the calorie intake is also controlled, but with satisfaction. Now, supplements and exercise. What kind of supplements are required to the body? Vitamin B12 is required, vitamin D, cinnamon, magnesium, chromium, all these are requirements. Now, they have given different tables and charts where each magnesium out of vegetables, chromium is produced by these vegetables. So, that I have not put into the slides. Exercise can be classified into three. Exercise is very important. Why each exercise is important, I'll be dealing with three. Basically, the exercises are classified into three types. There can be aerobics, that is brisk walking, tennis, dancing, skating. All these come under aerobics. They reduce the blood sugar level and the triglycerides directly. There is something called as resistant training or weightlifting, the dumbbells, everything which they do, that helps in increasing the insulin sensitivity in muscles. What happens in weightlifting? There is a resistance you give to the muscle. You are shaping up the muscle. So the cells of the muscle become very sensitive. So the insulin uptake is taken. So that is why exercise plays a very important role. Flexibility, yoga stretches keep the range of movements intact. There are so many arthropathic symptoms or like diseases coming due to diabetes. Diabetic induced arthropathies happen. Diabetes induced frozen shoulder, diabetes induced arthritis, charcot's arthritis, everything is given. So such arthritis can be avoided, so flexibility is maintained. So like we can make a exercise plan to the patient which includes a little bit of aerobics, resistance and flexibility, that overall there is a good health status of the patient. Now they have also mentioned how to maintain a healthy heart. Healthy heart is also important. Again, three main things are: skip animal products completely, keep oils to minimum, add special effect foods. What are the special effect foods there? Oats, barley, soya products, almonds, walnuts, fruits and vegetables. All such foods have to be included on daily basis. Overnight weight loss guidelines, or like weight loss is a very important thing, because once weight loss happens, cholesterol gets decreased. Once cholesterol is less, there is no blockage happening, the vessels are not thick, the blood flow is not obstructed, that's leading to healthy heart. Again, exercise helps in reducing the triglycerides and improves the blood flow to the organs. So exercise also plays a very important role. Thank you. Yeah, this is ending of the presentation.
Thanks, doctor. Thanks for that nice presentation. So, what we'll do is, I will briefly talk about the work that we guys are doing. So then probably we'll take a few Q&A things. So, okay, it's Naveen here. I am the founder of DivineVeda Healthcare Private Limited. We started this organization around 3 years back. We mainly work on metabolic disorders and autoimmune disorders and all those things. We have a very good track record. So we have been, especially now in recent times, we are concentrating on metabolic disorders like diabetes reversal, especially the type 1 and type 2 diabetes reversal. And we have a very good success track record. And also we have testimonials. So what I suggest is, I will be sharing the WhatsApp group. So in that, probably people interested to reverse their diabetes can join this, and also they can share it with their friends and relatives. So we can right now we can take up the Q&A question and answers. If anybody has their questions, they can ask those questions.
Thank you, doctor. It was a very nice presentation and very useful on such a relevant subject. I have few questions. I have few patients in my family actually, and two of them are doctor themselves. They are gynecologists, but they have diabetes. One has type 1 diabetes, other is type 2. Actually, when in day-to-day life, when I, hear about their problems, their main problem is, the weight gain. And weight gain is, does it happen because of insulin? They are on insulin.
Yeah, weight gain happens because of the insulin also, because insulin is being continuously given externally for the utilization of glucose, but the glucose is not being utilized. What happens is, suppose we start with insulin of 10 units today, and continuously given. After some time, that much insulin is also not enough for the body. We have to go on keeping increasing the insulin units of the body, which is again leading to like increased weight gain, increased fatigue in the person.
Okay. So can they, diabetic patient, can they go for fasting? If they gain weight, can they safely go for fasting?
So fasting is also different types of fasting. Fasting doesn't mean completely avoiding the food. It depends on the disease and the person also. There can be fruit fasting, there can be juice fasting,
Okay.
there are different kinds of fasting based on the person, their sugar levels, everything. We can give like we can modify a kind of fasting and be prescribing to them.
Okay. And doctor, in case of hypoglycemia, which you talked about, isn't it safe to leave insulin? Because hypoglycemia, it causes very low sugar, and it is more dangerous. So, shouldn't they leave insulin if they face it frequently? If they go for dietary change, like they go for fiber rich diet and the diet you suggested, so what if they find their level is going down, sugar level is going down? So at that time, is it safe to reduce insulin or just leave it?
Yeah.
Yes, yes, ma'am.
I would like to answer this question.
Okay.
What I have seen is in my patients, especially, so when they start following fiber-rich diets, obviously the insulin levels will go down. Okay, so
Okay.
at that time, if they are on insulin, it is advised to stop the insulin or reduce the insulin dosage. Okay,
Okay.
so and it has to be done under the guidance of the doctors. Okay,
Okay.
so like that's what I advise is let them join this group. Okay,
Okay.
so the link to join this group we have shared it in the WhatsApp group. Okay,
Okay.
then probably we'll be able to guide it. Okay,
Okay.
so it is
Sure.
and
I'll
it is actually it is a very lengthy process. It normally takes around 2 to 3 months of time. Okay, for any diabetic patient to completely reverse the type 2 diabetes, especially the type 2 diabetes. So what I have seen is in one of type 1 diabetes cases. Okay, so he was able to reverse type 1 diabetes because he was very young. He was only hardly 20 years, and he came to me when it was diagnosed. Okay,
Okay.
so he didn't suffer with type 1 diabetes for a very long time. So when we do the interventions at that time, then the recovery will be very fast. Okay,
Okay. What about those who have it for years? Can they also reverse
yeah,
it?
we have
Type
to,
1.
yes.
I'm talking about type 1.
Yeah, exactly. Good question. So it all depends upon the age of the patient. Okay.
Okay.
And also like if somebody is around 65, 70 years, something like that, and if they have suffered for a very long time, then it is little bit difficult. Okay.
Okay.
So it all depends upon their, we have to do the C peptide test. Okay. So those tests we have to look into that, and also we need to look into the levels of the values in that test.
Okay.
Okay, so then if it is not on the higher side, then probably we'll be able to reverse it. So that's what I suggest is let them get in touch with us. Okay, we have a team of doctors and health coaches, dietitians, and all those people. So we'll be able to help them out. Okay.
Okay.
Thanks,
Doctor,
madam.
one book you were talking about, can you mention the author's name and the book name?
It is Neil Bernard.
Neil
It's a,
Bernard's.
yeah.
Okay.
Is an
What is the name of the book?
I think can somebody
Reversing.
share it? Can somebody share it in WhatsApp in the chat window? So it is actually he has worked mainly on diabetes reversal. He works on functional medicine. Okay, I have been mentored under him. So he's based he's based out of US. So we normally work on his principles, and we have got tremendous result.
Okay.
Yeah.
And can you please show the few beginning slides, first few slides where I missed that because the presentation when I started.
Yeah, I will share it. I will share it
So,
once again.
and that's towards the end. Towards the end. Thank you
Yeah.
so much, doctor. Thank you, Naveen ji.
Content, what is diabetes and its types, optimal lifestyle and principles for new menu, power plate and program, role of supplements and exercise. So here it is, doctor spoke about the what is diabetes and all those things. So it is the diagnosis condition and the parameters on which we declare that the patient is diabetic. And also the GTT, also called as oral glucose tolerance test. So recently, few of my patients cleared this test. Okay, here what we'll be doing is we'll be taking 75 grams of glucose or else like 75 grams of sugar when we are fasting, and we need to do the glucose test before we start this test, and afterwards we need to do every half an hour for 4 times. So if it is below and during the fasting, the value should be around between 70 to 100, and during the performing of this test, it has to be in the range of around 100 to 140, below 140. So milligram per deciliter. So when we do this, and if the values are under control, then we declare that the concerned person has cleared this GTT, glucose tolerance test. So this is type 1 diabetes. So in few cases, what I have seen is few patients will be between type 1 and type 2. They are also called as 1.5 diabetes. This is about type 2 diabetes. This is about gestational diabetes. So the treatment modalities. So the doctor spoke about the optimal lifestyles and also the 4 pillars of reversing diabetes: healthy diet, no smoking, regular exercise, and stress management. This is very, very important. Stress management is very, very important when it comes to reversal of diabetes. New understanding of type 1 diabetes. So
From
powerful.
here, I have.
Okay. Yeah. Set aside these animal products like animal products normally have only for example, animal products includes dairy products and also the meat. So, but here the big problem with animal products is they only have fat, but they don't have any fiber. So this is one of the major cause of diabetes.
Naveen ji, what I know, I've been listening to Neil Bernard's videos.
Yeah.
And what I understand, he is vegan and vegan doctor.
Yeah.
And what I understand, they promote taking coconut milk, and so coconut has saturated fat, but supposed to be really good for the body.
Yeah, that's what actually even coconut oil is not good. Okay, whereas coconut with normally what we do is at home we cook oil free. We go for oil free cooking, and we use lot of grated coconut. Okay, so here what will happen is apart from the fat, you will also be getting the fiber. So your fat consumption should be accompanied by the fiber. Only then it will be good for your health. And also we need to favor foods with low glycemic index. Set aside animal products and like beef, chicken, and fish, eggs, etc. Uh,
This, these slides I have.
yeah. And also
I noted.
low glycemic index foods are very, very important. So whole grain and also legumes. Even what I have tested with my patients and also on myself is whenever we go for uh, the grain-free diet, right? At that time, the sugar levels, the glucose levels will drop very well, and we'll be able to stabilize the glucose level very fast. That is very, very important, and we have to concentrate on this diet. So here, doctor spoke about the dairy milk, egg, sugar cravings, so all these things. And also she spoke about the alternatives. So this is the program. Check out the new possibilities like breakfast, sample breakfast, like what should be there, and also lunch and dinner and snacks. So that's what actually in our 3 months program, what we'll be doing is we'll be concentrating on all these things. We try to build the habits and also we track it and we make sure that everybody is following this diet implementation and lifestyle implementation. Exercises and all those things. When we do this, and we have to concentrate on the consistency. When we do that, what will happen is obviously everybody will get good result. So this is basic foods to test and try. Healthy weight loss and also vitamin B12 supplements and vitamin D supplements are very, very important.
The level of B12 to maintain?
Yeah, it is normally what I suggest for my patients is around 400 to 500 is the very good range. So and also when it comes to this vitamin D, around 40 to 50 is the best range. Actually, especially when it comes to autoimmune disorders, what we do is we give supplements and we take the vitamin D levels to a toxic levels. Even if it is toxic also, no issues. What will happen is it will help in reversing autoimmune disorders also. Actually, what vitamin D is also called as master hormone. So it governs many things and it will help in reversing the autoimmune disorders very fast.
Toxic level is above 70?
Yeah, around 60 to 70. So, and she spoke about hypoglycemia. Yeah, and also how to control the symptoms and also how to control the hypoglycemia. So fiber check in diet, supplements, and exercise. These two things are very, very important. More than the exercise, what I suggest is we need to go for pranayama and meditation. This is very, very important. Even if we do it two times in a day also, it is very good. See, many people will not be able to do the exercise, but everybody will be able to do pranayama and meditation. So see, a few people will be extremely obese and they will not be able to move, but still they will be able to do pranayama meditation twice in a day. Healthy chart. That's it. Thanks, madam. Madhuji, thanks for joining this program and also joining this session. Okay, for vitamin B12 supplements, there are two things. One is methylcobalamin and cyanocobalamin, but our body synthesize very well methylcobalamin. So normally we suggest methylcobalamin for our patients. I've shared the WhatsApp group. Okay. So this is mainly focused on reversing diabetes. You can even share with your friends and relatives, so they can join. And in probably in another 3-4 days, I am going to start a small program for around 15 days. So where we'll be concentrating and on diabetes reversal. Okay. So if we don't have any questions, okay, Prerana has Dr. Prerana
Yeah,
has
hi.
one. Yeah.
Hi, sir. Hi, sir.
Yeah, you can
So,
ask.
yeah, my question is, this diabetes reversal diet is mostly based on a vegan food. So
It is
there are
not.
there is
It
huh,
is not on vegan food. It is mainly
okay.
on. It is mainly on whole food plant-based diet.
Okay, okay. So there is a one group who supports this, and there is another group also who has some difficulties in going through this vegan diet. So
Okay.
my question was that is anything drawback from a vegan food that we are deficiency in some important minerals or vitamins, whatever we're getting for the animal foods.
Okay.
So in a long term run, is there any possibility?
Okay. Good
Thank you,
question.
sir.
Good question.
Mm.
Thanks for asking this question.
Yes.
See, what I have normally seen is uh, there is in whole food plant-based diet there is no issues. Okay. Mm, and this is this diet we are going to mainly look into it at the during the treatment program that will be around 3 to 4 months. Okay. And when it comes to the whole food plant-based diet, right? Okay, so I will ask one hypothetical question. Okay, see, whenever you are there, for example, you are in a desert and you're lost. Okay, and for 2 days you are not having any food. Okay, so what we'll do is I will give you so suddenly you will find one place, and there one house is there, and someone will offer you a food, 1 kg of chicken and 1 kg of fruits. Okay, what will be your first choice?
I think fruits will be first choice because it's a desert.
Yeah.
We
No,
the
no,
water is.
it is not about
Mm,
desert. It is not about
mm,
anything, but fruits are the natural choice. Okay,
okay.
that is the natural food. Okay, and fruits has everything. See, our body needs two things. One is macronutrients and another is micronutrients. Okay, macronutrients are nothing but carbohydrates, fat, and protein. Okay, fruits has all these things. There is a avocado, for example. Avocado has very good plant-based fat, so it is having in all the required quantity. Okay, so the thing is that what we have to do is we have to select which is available at our place, which is grown naturally. Okay, and which is seasonal. Okay, so when we consume it, obviously nothing will happen. Okay, and there are carbohydrates which we can consume in a limited quantity. Okay, see, I will ask the same question. Okay, when it comes to the carbohydrates. Okay, grains, especially the grains. Okay, you are there in the you are there in a forest. Okay, or else like you are there in a desert. Okay, so suddenly what will happen? We'll offer you 1 kg of wheat, or else like 1 kg of rice and 1 kg of fruits. Which is your natural choice? Obviously the fruits. Correct, no?
Yes. Mm.
So you could have
Yes, sir.
you could have told that okay, I will eat 1 kg of grains or something like that. And the major problem with grains is grains has something called anti-nutrients. Okay, it is actually not made for human consumption. The problem is we have adopted to that knowingly or unknowingly, and that is causing a lot of health problems. So same with same. See, for example, you might have been in a rural village side, something like that. Okay, so when you go there, you will have a paddy field, and next to that you will be having a mango orchard, or else like fruit orchard. Okay, so by seeing what you will mouth will start watering. Obviously, the fruit orchard. Correct, no? you
Yes, sir.
your mouth will not start watering when you by seeing the paddy field. Does it happen?
No.
Then so it is it is very much natural. Okay, so that is what is our natural food. Okay, that's it. It is all like, see, obviously this animal protein and dairy and all those things is controlled by a mafia. So they normally will not try to lose the market share. So obviously they will be recommending all these things. Okay, so it is not an issue. Okay, so
Yeah, thank you, sir.
definitely it works very well. Okay, Okay.
Okay, thank you, sir.
So hope somebody has asked a few questions. Fish like sardine, etc., contain omega-3 fatty acid and vitamin D. Of course, fried is restricted. What about oil-free fish preparation? Okay. See, even if you do oil-free fish preparation, it will still have fat. Okay. See, what will happen is animals are the only one which produce cholesterol because their liver produces cholesterol. Um, and also our body produces the cholesterol in required quantity. Okay, we normally don't require all this animal protein and animal fat. Okay, so when we consume this what is that the animal protein and animal fat and all those things, like oil, fish, and meat and all those things, then what will happen? Obviously, we'll end up having a lot of cholesterol. So these things will harm our body, and so it will lead to lot of health issues. So it is not advised. Okay. Are the different types of rice like red, rajmadi, pongar, brown, matta allowed for diabetes except polished and white rice? Yeah, it's a good question. Yeah, you can have it, but as I said, it is not needed. Actually, we are not designed to consume all these things. Okay, so our body is not designed to eat these things, and even if we are eating, also, what we have to do is we have to make sure that one bowl of the millets and or else like one bowl of rajmadi rice has to be eaten with 2 to 3 bowls of salads and vegetable curry and those things. So if we do that, then what will happen is it will our carbs will be get loaded with fiber. So when that happens, then what will happen is this fiber will hold the glucose. It will not get released to the bloodstream immediately. So then our glucose levels will be under control. This is the science. Nagajyoti has asked which vegetable oil is better for diabetic patients having other comorbidities, etc. Okay. See, all vegetable oils are not good for our health. Okay. So even as if you want to consume, yes, but we require fat, but that fat has to be consumed in with fiber. So that is why whenever we go, we normally do oil free cooking, but we put grated coconut in a abundant quantity. Okay, and also we also put groundnut in the salads and also sesame seeds. So by this we'll get required fat with micronutrients and micro minerals, and also we'll be getting fiber. Okay, I'm not able to understand. Is vitamin D through direct sunlight necessary if taking vitamin D supplements? Okay, see, all these supplements, right? It is a stopgap arrangement. When your vitamin D levels and vitamin B12 supplements are less, so what will happen is to recover it, it will take a lot of time. So what we normally do is then we cannot purely depend on vitamin D and vitamin B12 on from natural source. Okay, so and also there are a lot of restrictions like vitamin D. Nowadays we are having so many issues, and also with vitamin B12, like we have this 5G and all those things. Okay, those things will obstruct the absorption of vitamin B12 levels. Okay, so that is why we take supplements from outside. So what we have to do is we have to take these supplements, and also parallelly we have to go for direct sunlight, sunbathing, and also for vitamin B12 supplements, what we have to do is we have to take fermented food and all those things, which will increase our vitamin B12 levels naturally. What about LDL level is average high after having vegan food for 3 weeks?
Sir, if the diabetic person is having low density lipoprotein is high or average,
Okay.
after having 3 weeks of vegan food, the
Yeah.
starting time is 3 weeks, right?
Yeah.
Less than 1 month, he has to try the new menu.
Yeah.
If it is high, then what next?
No,
What?
LDL is good, right? It's yeah, HDL is a good hormone,
Yes,
yeah,
HDL
a
is
good
good. It
cholesterol.
will be
LDL is a
going out from the
bad
body.
thing.
Yes,
But
it is a bad cholesterol.
yeah, but your LDLs will not go up. Actually, it will come down.
No, sir. After having that, it will come down. Before, if it
Yeah,
is high or average or it is up.
yeah. LDL should be less, right? What is the issue then?
No, sir. What I am telling you is, if the person is having his blood pressure is more than the normal, and
Yeah,
also he is having diabetes, and
yeah.
also having little bit or slight heart diseases.
Okay.
So obviously his LDL will be high only. Triglycerides will be
Yeah,
high only.
yeah, yeah,
In
yeah.
that, what else menu we can add in this diet, or what other alternates we can do for that?
See, if you adopt this whole food plant-based diet, everything will get normalized. Even if it is LDL is high, also it will come down. When it comes
Okay,
down, when it comes
okay,
down,
sir.
when it comes
Hmm.
down, nothing will happen. See, in some patients, what I have observed is they will start getting giddiness. Okay, so all those things, because what will happen in some places, in some times, what will happen, there will be electrolyte imbalance. Okay, so at that time, we normally advise them to take coconut water. Okay, so if it is done, then normally everything will be all right. See, I have faced so many bottlenecks. Okay, and my patients see a lot of ups and downs. Okay, so all those things will get normalized in few days time. Okay.
Okay, sir. Okay, sir.
Okay.
Thank you.
Yeah, thank you. Okay, so we'll wind up this presentation. Thanks to Simnaini for giving this wonderful presentation. So thanks everybody for joining this workshop and also the session. Thank you very much.